Hello everyone, welcome back to my channel. This is Arpitha Kadubi from Kadubi Yoga, and today I'm very honored to introduce to you Dr. Subramanian Kannan, who is the HOD of Endocrinology at Narayana Health. So, being a yoga practitioner himself, he has a lot to say about how yoga helps improve the condition of diabetes. So, let's talk to him and see what he has to say. Hi, doctor. Thank you so much for taking this time and answering these few questions. So, what I've done is collated a few questions from a few patients and my clients as well, questions which they had about being diabetic. So, I thought it's better to talk to you and see what you have to say about yoga and diabetes. So, I'll get started with the first question.
I just wanted to introduce myself as well, so that the audience will know whom you're talking to.
Okay, let me. Okay.
So thanks, Arpitha, for conducting this little interview with me. I am Dr. Subramanian Kannan. I'm an endocrinologist, and I head the Department of Endocrinology, Diabetes, and Metabolism at Narayana Health City, Bangalore. Having worked with the experts in yoga and being closely associated with the Vivekananda Institute as well, our experience has been very positive, and I would like to share some of our experience and some of our small but definitely pilot information that we have been getting through the interaction with the yoga therapists.
Thank you so much. So let's get started with the first question.
Sure.
So we see a lot of youngsters being diabetic of late. How has the modern lifestyle affected this particular situation?
Yeah, not only diabetes, but I think a whole lot of non-communicable disorders, including diabetes, hypertension, dyslipidemia, high cholesterol levels, fatty liver disease, obesity in general, have shifted almost 10 to 15 years early in their onset. What used to be a disease of 50s and 60s is now a disease of 30s and 40s. So this shift of the onset of these chronic medical conditions is something extremely concerning. There is definitely both a genetic component to this, or what we call an epigenetic component to this, where there's something that has changed in the last few years of how things have happened. And of course, the bulk of it is also the environment that they're living in terms of trying to, everybody's having their targets and goals to achieve, and they will do what it takes to get there, unfortunately neglecting the body that they have to use. The problem with these chronic illness that are occurring early on is that people are now living longer as well. So it's that you have to carry along with these illnesses for a much longer time, which means that we are likely to see people with these the complications of these disorders much more. So the prevalence of diabetic kidney disease, diabetic eye disease, hypertensive cardiac disease, cholesterol related coronary disease are all going to just go up in number sheerly because these problems are now coming at a much earlier stage of the game.
Right. So the second question is it possible to reverse diabetes through yoga?
Yeah. So all non-communicable diseases do stem from, as I said, there is going to be some amount of genetic component and some amount of environmental component. What is the proportion of each component contributing to a particular problem is difficult to judge on a clinical day-to-day basis, but then there are definitely studies to show and prove that there is a contribution by a genetic component and a contribution by environmental component. So in a very simple language, I want to say that all these non-communicable diseases that we have a reversible component and irreversible component. The irreversible component is mediated by your genetic makeup, your family history, or the genes that you've undertaken since birth. Then there is this irreversible component. That is the irreversible component. The reversible component is the one that is contributed predominantly by behavior and by the environment that we live in. So the impact of that can definitely be reversed. Now, diabetes per se, the concept of diabetes reversal first came about with bariatric surgery. When patients underwent bariatric surgery, we came to know that their diabetes almost became normal. They didn't need insulin, they didn't need tablets. But then we also realized it was not only bariatric surgery. There were other studies which has looked at low calorie diet, very low calorie diet, and obviously the more popular the low carb high fat diet. So multiple of these dietary interventions have also shown to reverse diabetes. The question being, how long can you stay off medicines or off any interventions for diabetes? The longest data we have is with bariatric surgery. All the other things, the data is probably limited to about 2 to 3 years. The question about yoga and diabetes, as I said, if the contribution to the problem is predominantly a reversible component, which means that there has been a very bad lifestyle and a very bad diet and lifestyle that has contributed to the diabetes, then definitely yoga will help in multitude of ways. It's just not doing, moving your limbs and getting into some complicated positions. I don't think yoga is that. Yoga is that simple. Yoga is much more deeper in terms of getting a control over your mind. And I think the control over the mind will definitely enhance the way you're going to approach life, approach every single thing that you're going to face in life, be it the food choices you make, be it the exercise schedule that you have to do, be it the work pressure that you're going to deal with. So everything in life will start becoming a little different, and you will start making a more conscious decision of these things. So I think the answer to your question is very complicated, but I will tell that there is definitely a reversible feature in many patients with the young onset type 2 diabetes. And if the reversible component is taken care with diet, with lifestyle, through yoga. So yoga is kind of the fundamental block upon which you build up many other things. So if you're able to control your mind in terms of by these practices of breathing as well as asanas, then your ability to make choices about food, make choices about your work life as well as your exercise schedule and your medication ritual and your other parameters, your regular testing, your checkups, everything will fall in place. So I think the platform is very important.
Right.
I would assume that if things go well and patients, the component of reversibility is very high, then definitely yes, that is a good possibility that you could reverse diabetes, you could come off medicines. Having said that, this has to be done through in the proper channel.
Right. So I think that answers the next question, which is how does stress affect? Can stress cause diabetes? So I think this covers that as well. So let's.
Yeah, it's as I said. I mean, I just want to add one more point. People think it's so simple that you say that I ate, I was stressed, that's why my sugars are high. It's not as simple as it is. I mean, if it were to be so simple, I think by now people would have found a cure for it. I think the multifactorial the multifactorial components which result in diabetes is what makes it very complicated. So it's not like I just reverse one factor and my sugars will go away. No, it's going to be a multitude of factors. I said there's going to be a reversible component and an irreversible component. We should understand both in terms of what your diabetes is being is a result of, and to answer certain questions.
Right. Okay. So that leads to the next question, which is, can I avoid taking medicines and insulin if I do yoga?
Yeah. So I think this is exactly the message I wanted to convey, and setting up this interview was the main intention is not to neglect proven therapies. Diabetes medications and insulins have been in this world for more than 50-60 years, and we have seen how they have transformed the lives of people. I mean, if you look at insulin, it's got almost close to 80-90 years of existence, and it has transformed the lives of many children and many people who have type 1 or insulin deficient diabetes. Of course, in type 2 diabetes, there is a stage when the body's ability to make insulin starts coming down. So as I said, the reversible, irreversible, when you look at diabetes alone, you have a component of insulin resistance where the insulin is not able to work very well. And then there's a component of insulin deficiency. So again, what proportion of your diabetes is mediated by insulin resistance and what proportion by insulin deficiency will actually tell you how you will respond to non-medical therapies. So medications and insulin are predominantly helping you to improve your insulin secretion, improve your insulin deficiency, or replace your insulin deficiency. And certain medicines will lower your insulin resistance. Whereas not many non-medical therapies will actually help you improve your insulin secretion. They're very little. What proportion contributes to your diabetes is very important to understand. And I think your doctor will be your diabetologist, your endocrinologist will be the right person to tell you which medicines to cut down. Of course, when you go on to any new exercise regimen, any new therapy regimen on a consistent basis, you are likely to drop your sugars down. And that's an effect that we will discuss later on in our talk. But when you do that, you should know which medicines to cut down, which medicines to stop. And I think that help, you should approach your doctor and get that information, because randomly choosing a medicine to stop sometimes may become detrimental. I mean, the medicine that you might stop may not cause low sugars, whereas the other medicine that you've been taking in the morning might have caused low sugars. So it may not be so simple to decide which one to stop or which one to decrease. So I think these things, talk to your physician, particularly when you're engaging into a strict, dedicated regimen. For that matter, John, not only yoga, if you take up anything, if you take up running, you take up a strict personal trainer assisted gym exercises, your sugars are likely to drop. So you have to be a little careful in terms of what medicines to take and what not to take. Check with your physician, your doctor, to adjust your medications when you're getting along with a dedicated and a consistent regime. The one-time yoga, doing one day exercise or half a day thing and then forgetting about it is really not going to change things. So people tend to get carried away with just one day things, and those things are not going to affect things. I mean, it has to be a consistent practice.
Correct. So that actually leads to the next question again. If a person is not in the habit of exercising, will simple exercises still help?
Yeah, I mean, any exercise will help. I mean, that's the bottom line. I mean, sedentary lifestyle is going to be a killer. Sedentary lifestyles are going to affect you in two ways. One, obviously, you are going to have a positive calorie balance by the end of the day. Most Indian foods are rich in carbohydrates and calories. So by the end of the day, if you have not moved from your chair, from your work from home chair, then it is very likely that you will end up with positive calorie balance. That's one. Number two, without moving, your muscles are going to become more and more atrophy or less. The muscle mass or the lean body mass starts to become lesser. Now, this becomes very important in the diabetes context, because insulin works on the muscle to improve or send the sugars into the muscle fibers. So your muscles will actually, if you have less muscle, then you're going to present the problem of less sugar uptake, or there's going to be a component of diminished sugar uptake in the periphery. So you are going to end up having more and more conversion of these sugar into fat, particularly around the liver. So sedentary lifestyle it's a bad idea, because you're ending up with positive calorie balance, as well as you're also ending up with less of a lean body mass, or the less of muscle mass, which contributes in great way in the pathophysiology of diabetes, particularly in India, where we have this entity of sarcopenia. We already, our ability to make insulin is less compared to the Westerners as a Southeast Asian. So we are, by birth, less producers of insulin. And added to that, if you also reduce your muscle mass, sarcopenia, then you end up, manifesting diabetes early on. That's one of the reasons why diabetes is starting to occur much early in life. So improving your muscle power, the bulk of your muscle is a very, very important weapon against diabetes. So some of the practices of yoga, the whole idea is basically to stretch and relax. So you put your muscles to action. You put your muscles that you've never used in your life. I mean, you're just sitting and you're really not worried about what the quadriceps are doing, what the hamstrings are doing, what your paraspinal muscles are doing. We just are clueless about many muscles that we have, and unfortunately, we've forgotten them. So because they're not needed for your general sitting down and lying down postures. But when you start doing these various asanas, you put these muscles into action, and I think that's a very important thing in terms of helping in the long run.
Right. So what we say in yoga is, so basically yoga is an isometric exercise. So when we did our studies in SVASA, they say that isometric exercise actually use more muscle than a regular dynamic workout. Also, yoga asanas, because you're in a static position, it improves the blood flow. So does this really help with diabetes?
I think the combination of isometric and isotonic exercise are both good. I mean, I wouldn't take away and I wouldn't say one is better than the other. Both are equally important. I said, and I think isometric exercise is often forgotten. We're all
Right.
so much involved in running,
Correct.
jogging, and treadmills and ellipticals, which are all mainly isotonic.
Right.
So the isometric, where you really put your muscle to taut positions and then relax it, is a very important way of improving your muscle mass as well. So I wouldn't say one is better than the other, but I think doing both is very useful. And in fact, some of the best physical trainers have been emphasizing on the role of both, and so that's very important. So if you get a good balance of both isotonic and isometric exercises, it does a world of good to your um, insulin resistance as well as the glucose uptake from the peripheral.
Okay. So let's move on to the next one. What is the impact of practicing yoga in the long run on diabetes? I think we have covered that already.
Yeah, I just want to add that, just re-emphasize what I said. I mean, yoga is just not, don't equate your yoga therapy or your yoga asana therapy or your session of yoga to a 30-minute treadmill exercise. I mean, I don't think it's equivalent. I think there are benefits much more than what that 30 minutes of exercise is doing. It's got an effect on the mind. It's
Right.
got an effect on your body. It's got an effect on your muscles. It's got an effect on your overall core of the body, which is very important in this current day and age. So I think it's important we don't equate it as I did a 30-minute treadmill, I did a 30-minute yoga, which is better. People tend to compare and ask. In fact, one of my colleagues and friends from SVASA did a very nice study on comparing morning walk and yoga, and found that yoga therapy seems to have a longer lasting effect on the glucose metabolism. Our small study pilot work on continuous glucose monitoring as well showed that it is not just the 30-minute or 40 minutes that you do in the morning that is helping your sugars. In fact, the effects are persistent throughout the day, in fact, even to the night. So it's fascinating that the effects can be long lasting. One of the scientific clues, and this is our hypothesis why this might be happening, is the uh, balance between sympathetic and parasympathetic nerves. Now, we have something called as voluntary nerve system and involuntary nerve system. The involuntary nerve system is called the autonomic nerve system. The autonomic nerve system has two components, the sympathetic and the parasympathetic. Sympathetic is the stress response. Parasympathetic is the non-stress, the opposite of what you would think. So one of the theories of early diabetes pathophysiology, or one of the things that is dysregulated in diabetes, one of the components of pathophysiology of diabetes is actually an imbalance in your autonomic nervous system. So you tend to have a higher discharge from the sympathetic nervous system, which makes your heartbeat go up a little higher. Your heartbeat is not varying with your position of the body or with your breathing. These things are lack of heart rate variability, and your blood pressure fluctuations are not. There should be a normal dip in the night, which is not happening. So these things are subtle, but are the early stages of of resulting in all these non-communicable diseases. So if we are, this is a hypothesis again, is if we are correct, the yoga fundamentally is able to change this balance between sympathetic and parasympathetic axis, and thereby help in um, resetting this autonomic nervous system, and thereby help in overall the control of diabetes as well.
So, I mean, in layman terms, what I understood by this is we say when stress hormones like cortisol is released, there's a lot of things like this which you just mentioned happen. I mean, I don't know if it's the same thing.
Cortisol is a byproduct of the sympathetic nerve system.
Right.
Sympathetic nerve system is innervates the gland which makes cortisol. So your cortisol production will, or your stress hormones like adrenaline or adrenaline will become higher when you are in a sympathetic drive is more. So these things come down when you are able to perform yoga in a proper way.
So actually, it makes a lot of sense what you said because the whole goal of yoga is to make sure that no matter what asana you're in, if you're inverted or whatever position, difficult position you're in, you're still able to maintain the breath and you're still able to maintain the heart rate at the same rate. So I think that kind of correlates with what you just said.
Yeah, I mean, I think very, very simple terms. I mean, forgetting about all these things is you start focusing on your breath.
Right, right.
We don't do that. I mean, on a day-to-day basis, you see patients. I do my work. I rarely focus on my breath. But then, yoga is a time when you actually take the time off and look back at your breath. Whatever complicated positions you are, whatever simple positions you are in, the only goal is to concentrate on your breath. And I think that focus, getting back to that simple focus, is so crucial in some of the benefits that we get from yoga.
Okay. So the next one, this is something that I get a lot. Is it not enough if I do household work? Because that itself is quite a lot of work that they do.
Yeah, this is not only for you, but I also get the same question. I mean, in terms of exercise, when I recommend that whatever suits them to do, and they say that they're busy with their household work, and that should be enough exercise. Unfortunately, no. Unfortunately, no. The exercise that we end up doing with household work may not be enough, given the exertion involved in the current household work. Current household is very much
Right.
mechanized. You're not in the old homes where you had to grind the
Right.
rice in the stone grinder. We're not in that age, so the amount of exertion involved in the current household work is not enough, unfortunately. As I said, people who are at home throughout the day tend to accumulate carbohydrates and calories over a period of time, and so they end up in a positive calorie balance, and the household work expenditure of calories is not enough or not sufficient to get them to negative or at least equal balance. So some kind of an extra exercise schedule is always recommended for all patients. Yeah, my most one of the favorite things that I do for most patients who have a lot of joint pains, who cannot walk around too much, who cannot really do a lot of activity, is to start the simple 10-minute walk after their meals. So unless they have some cardiac issues, then I not do that. But if there's no cardiac ailment and otherwise they are fit, I ask them to do a 10 to 15-minute walk after their meals. And post-meal exercise or walking has shown a tremendous improvement in pregnant women. And we extrapolate that information to elderly people as well as people with morbidities who cannot walk too long. We do a short burst of 10 to 15 minutes of walk, not just a stroll, but a reasonably brisk walk after their meals, and that can sort of cut down or bring down the glucose levels post meal, where in which the overall weight also starts coming down.
So actually that leads to the next question, which is about gestational diabetes. So does this really, if a pregnant woman is diabetic, does that mean that she will be diabetic after a pregnancy as well?
Gestational diabetes is a very unique entity where patients who have no history of diabetes, who are absolutely normal before their pregnancy, start showing signs of diabetes during their pregnancy. Now, there are two forms of it. The form that is picked up very early in pregnancy, as soon as they are pregnant, 6 to 8 weeks pregnancy, you see the sugar levels are high. That is not the gestational diabetes. That means they were previously diabetic, they just did not know, and they got picked up because they got a blood test during pregnancy. The more classic way, or the way that we all know gestational diabetes, is the diabetes that happens during the second or early third or late second trimester, 27 to 32 weeks. Now, this diabetes is because of a multitude of hormones that the placenta makes. The placenta makes a lot of hormones that are going to act against insulin. And so when the body is not able to counter this placental hormones, the sugar levels start going. In a way, it was good because the sugars, extra sugars, go to the baby, and the baby tends to grow well. That's how nature was created to do this. But if the numbers go beyond a certain limit, then you have complications related to excess glucose going to the baby size becoming bigger, and more amniotic fluid, early chances of early pregnancy, early labor. So these are complications that come up with that. So gestation, and most patients who have gestational diabetes tend to recover, and the sugars become normal as soon as the baby is delivered. But keep in mind, women who have not lost their pregnancy weight, women who, whatever weight they've gained during pregnancy, if people who have not lost their pregnancy weight are almost certain to develop some form of diabetes later on in their life as well. This is in contrast to people who have lost their weight, then their chances of getting diabetes later on is much less. So if there's one important message for the gestational diabetes is to make sure that they lose their pregnancy weight quickly enough. The post pregnancy, there's a lot of pampering to feed the mother so that the baby can get milk.
Right.
But unfortunately, if you've not lost weight, and it's a difficult time for the mother because it's a newborn, feeding, sleep issues. So it's a very difficult 6 to 8 months. If you've not lost your weight in the first 6 to 8 months after the pregnancy, and you've been a gestational diabetic, there's a good chance that your diabetes can return back. So I think I don't have much scientific experience on this area, but I will tell that yoga can definitely be a good adjunct, both for the mind as well as for the body, in terms of helping the mothers do both during pregnancy as well as after the pregnancy. I just wanted to go on.
So after is when generally they get the seriousness to come back to shape because of all.
I think that's very, very important. I think to promote this concept of make sure that your pregnancy weight is lost is an important element, particularly in those who have developed gestational diabetes.
You were going to add something.
I was going to add one important point. I mean, don't do yoga without a proper instructor. And I think that's an important message also is to carry along with this. There are incidences of low back pain, back issues, spine issues that crop up when you do yoga without the aid of a proper instructor, an instructor who knows your health conditions well, who knows what is your capacity, what your comorbidities and your illnesses are in the past, and so can advise you the right asanas and the things that you should not be doing. Again, certain asanas involve a lot of breath holding, and sometimes it may lead to problems, particularly when people who are older, people who have joints issues, people who have back issues, pregnant women. All these things, I think, get a good yoga therapist and an instructor who knows your medical condition and who can advise the do's and don'ts correctly. That's very important.
So yeah, that's one thing that I hear a lot as well. So when I meet a patient, and generally they say, I've been doing a lot of yoga, but then I've not lost weight. But then when I actually ask them to show me what they're doing, there's a lot of things that they do incorrectly. So when I ask them, where did you learn this from? It's always generally YouTube. So what I feel is, YouTube, the person might be instructing very well, but then you don't know what you're doing. You don't see yourself, you don't know which position you're holding your hands or your legs. It might be totally incorrect. So I think, that what you said is very important, that you do have a good instructor who can see what you're doing.
I mean, we are in a world with COVID-19, and I think a lot of things have through the digital platform. And I think as long as you are on a one-to-one with an instructor who can see and correct you live, that's very important. And once they say, okay, you are doing it correctly now, well, take it forward, do it yourself. No problem with that. But I think the instructor should validate what you're doing and make sure that you're in the correct position. If you do something incorrectly, just seeing some recording and then just do it incorrectly, you may end up worsening some issues.
Correct. I think we covered most of the questions. Okay, so this is the last question. Which kind of patients would you ideally suggest yoga to?
I think it is for all. I don't think I can say, I will choose this and I will choose that.
Right.
People should be interested, and people should be willing to do it. That's the most important thing. I mean, if you are not willing, nobody's going to force you to do this. But if you do it, you will find the benefits yourself. And as a physician, I know when Arpitha joined us in NH, we did the yoga therapy in the first thing in the morning before we went to our ward work, and that showed tremendous improvement in terms of our ability to handle things for a long period of time, and your energy levels are good in the evening. You're still not tired mentally. So those are important things. It's just not physical benefits. There are some mental benefits that only people who have done it can tell. So I think you offer it to everyone, and people who are interested and have experienced good things definitely will take it up. And of course, as I said, there are certain things that need to be restricted, and yoga can be tailored to people who cannot do difficult ones, cannot sit on the floor. You can really do Surya Namaskar sitting on a chair. That's how you can modify things to suit people's needs. So get a good instructor and start your practice of yoga. I'm pretty sure it has very, very powerful effects on your body and mind. Thank you.